John Fuller, and I'm the host for the Bɔdi Bεttεh Gentri program. We're at the Leone organization of Greater Manchester and in the Birmingham County. This show, the medical professionals within this show, they all are volunteer and they volunteer. Nobody they get paid. We do our normal out of the goodness and likeness for what we do and also for people. Today we talk about hypertension, high blood pressure. We're Dr. MSI Kamara, we're an emergency medicine consultant in Manchester, and I will deliver to you today. The class in a team, not to me and Dr. Kamara no more day. We get other people that we deal within the team. So I'll go run through quick and tell now who that to get within the team. Then after that we go start. For me family them, I need for caution on as well. Say dear, this program we're not there for replace on our doctors them, on our surgeons them, on our consultants. We only there also for giving a generalized advice. So at least if something they go wrong with we go get the understanding of what thing they go wrong with we and what we can do for prevent them here or when we go need for seek help. You know, sometimes they some problem can become worse because we take long for go seek advice. So if we begin understand the symptoms, then way some of the sickness here carry, we'll be able to reach out quick and seek for the right help. We will extend the life. So I will go forward now and introduce the team. Then after that, we will start. Unfortunately, we will not get everybody the pictures, but as time goes on, I will get a picture. Today, Dr. Mohamed Kamara, now I get for present to today. So I will go through the list. I will tell everybody within the team. Okay, like I see, this is an organization of Greater Manchester, and they bring this program to honor, and we all do for we benefit with people them. I make we do in Krio. So I'm not to say we say people not speak English, but sometimes they can explain certain things to me in English. Sometimes the interpretation can be confusing. So they encourage people them if you get any question, do you ask? But do you while the person they present, you will ask you not ask any question yet. You can ask them by text, but not try for interrupt. So we'll go for mute everybody while in the present. But once the presenter done, everybody will get chance for ask any question we ask and we will try for answer. If na question we will not get answer for or we feel say too personal, we will contact you personally and answer that question there. Okay. So today we get Dr. Kamara, when I the group lead in anything they do in our life, you get forget a leader. And Dr. Kamara and I are the leader. Like I be saying, an emergency medicine consultant, and I get for present for we today. So I go see and boku and I go hear voice a lot. Okay. The next person at the team again is to Kamara, a mental health nurse and a health visitor. In your own way they play within the team, you go to do more advice on mental health, even though you go to touch on other areas, but main area of specialty, mental health. The next person again, Mr. Abraham Sise, when I qualify social worker. And also, instead, we touch on mental health and anything regarding social work. The next person we're going to list now is Fatima Kuruma, when a new product development technologist and registered nutritionist. Basically, the kind of food they way for the eat. You know, black man, you know, now in Fatima go the advice we, but he go to give you advice who's kind of food for it, how for it, and because of they not about the kind of food as well, it's about how they prepare and about the portion. You know, so Fatima and I specialty than they go give you advice on anything and they. And Fatima don't present programming at the past, so I will encourage people then for go on YouTube and search for SLOGM in our slum health. If you go look for our YouTube, you will see all the other sessions they will get there. Next person on the list now Miss Aminata Jallo, when a clinical pharmacist. You will for advice about medication, whose kind of medicine they will for take, how for take medication, what are the practices. Okay, instead we don't present for we in the past, and as we go forward, we will get other session, then we instead present. Next person on the list, Miss Isa Tashaka, instead of a mental health nurse and also a qualified social worker. So instead with the buttress and give you advice on social welfare and social worker issues and also on mental health. Okay. The next person we get on the list now, Mrs. Fatima Kamara, when I'm auntie, myself a mental health nurse, but instead get areas them of specialty where if you ask question, even though not relate to mental health, given the experience you give advice with. So we get a varied people in our panel. And the last one not the least on the picture is here now myself. My name is John Fuller. I've been a business IT consultant. I don't work for a couple of organizations, big organizations in the world. My role within this team now for one for present, but two for give the team all the support they need for them to be successful. We also get other people within the panel. We get Miss Dr. Sise, Dr. Aziza Sise, who is a general practitioner instead go in our panel for give any advice and for give advice on things that we wanna go ask regarding medical issues or medical conditions. And we also get Dr. Mohammed Toure. We're not there with we today, but himself can get at the panel something day for help we for give and for answer questions them. So me fumble them and they can do now over to Dr. Kamar. However, if you get any questions or concern or feedback or suggestion, anything you get, when I feel say maybe you're not able to post them on here, we encourage you now, send them to we by email. If you look at the bottom now, we email address dede slomhealth@gmail.com. We will reply to you personally. If there's something in a personal question regarding medical condition, we will make sure say we protect you confidentiality. If there's something in a general question, no more, we will answer you, but also we'll make that question available and answer available for the general public so that people will benefit. So now, me fumble them and they can't mute people them. So they are big, long time for ask questions while the show they go on. Okay?
Yeah.
Okay.
We're good to go?
Yes, sir.
All right. Fumble them now do wherever on a day, on a take it on a journey today. Whether in the morning, afternoon, evening time or night, welcome to this session. Go the whole now fortnightly. We don't talk for some time now from where this COVID thing done the begin, and so we decide to make way with people them for then get for know about their body. You know, sickness, as I say, Nigerian enemy to mortal man. So now make it fine for we make sure we help one way or the other for we improve the health status of the people. Now make we form this group. So Well Bɔdi, obviously 9 past Gentri, then they tabi no different that. We don't talk for about different topics then, but today on I think we decide to this way very, very important for everybody in the world because it's a catch, well, I would say all man, put it that way. The only person we go exempt from, we're going to find out this now. But blood pressure taken from me in a very important subject because it linked to everything in the body, from the head to the toe, blood pressure they affect. So now make it fine for me to know how to deal with them. Yeah, so let me crack on because this is a big topic. And if I oh boy, if I move this thing. Right, okay. So today you know what they do. We look at blood pressure on your own, just an overview, like a summary. Look at the symptom the way you go look for if you get blood pressure. Now the problem is, but people don't know which are the symptoms of blood pressure. Today we're going to find out which thing they cause the blood pressure, how you go diagnose them, and of course when you go to doctor tell you say the blood pressure high, you find for you understand which they talk about. You know which are the readings of the blood pressure, whether they're day up or day down. And of course, if you get diagnosed with hypertension or high blood pressure, you need for let you know how you treat them. And of course, not only you go treat yourself, but of course, with people and get the remedy that we use, whether they're helpful or not or harmful, we will find out later. And of course, so doctor will either decide for treat you for what you diet, for what you weight, for what you lifestyle, and then maybe decide say put you on medication for start you with. Now that medication this one not go work. Or something you know go bring the blood pressure down like I want time. So you get for combine one or two, and then you get for change one or the other, and get for increase the dose, or it decrease the dose depending on how you respond. And of course, we as I talk no more, we home remedies them. People are going to use them. Now whether they help you or not, we will find out. Then of course we get blood pressure in special circumstances. Now we mama them, we sister them, auntie them. And we get picking them, of course, then they get Bεttεh, and when they get Bεttεh, then they experience this hypertension. So we did touch on them briefly because then I want no subject of you. I don't think so we'll go for deal with them deeply, but if I for let people know, say, yeah, when you get Bεttεh, possibly the blood pressure can go up and it can lead to some complications where it can affect the baby as well as the mommy. Of course, I don't talk on that. The effect where the blood pressure gets, where it go up on the body, on all the parts of the body, as I say, it affects the head to toe. And then, of course, ways and means of trying to prevent this blood pressure from go up, or if you get them, how to manage them so that it will cause you a long-term effect. But of course, from the beginning, I'm fine for we know waiting our blood pressure. Now, if you look at the then vein them, we'll get in our body, the artery them. Now through the 90 blood they pass. So the force where the heart they use for pump the blood around the body through the vein and the artery them. Now in they determine within the blood pressure tandem, you know. So we get blood pressure as we measure them, we get the one with the on top. If you take the machine where they measure the blood pressure, when it don't do in walk, when you press them for leg walk, it push you on, and then when it can't down, you release them. You will see say one figure they up and then the other one they down. And the one they up now then called systolic blood pressure. That's now where the heart they push the blood come out, you know, from where they push the blood come out. Now they get that pressure, that's that number there. And then the diastolic one now when the heart they rest between the heartbeat them. So when you tell the heart go boop boop, that boop there, when you boop boop, that boop there they tell you say the systolic 90 is where the thing they push the blood, and then between the two beep them, you get this the rest, the heart the rest, and then you get the diastolic one. So they can tell you something when you go to doctor, tell you say your blood pressure now 140/90, which means the 140 are the systolic and the 19 are the diastolic, you know. But obviously they can tell you as a general rule, the blood pressure we normal now 120/80, you know. And of course, they say if you go up, then they want you for aim between 140 and 90. And if you go down, that's not the other thing. That's not low blood pressure. So low blood pressure, you know, if you go less than 90/60, then they can say that in a lower one. But it's not just straightforward as that. We get 120/80. That means the blood pressure normal. So somebody there can get a pressure of 180/100. If you come to you and pressure they 120/80. Clearly, you don't drop them, so you got to be careful about that. These are the pitfalls that people can fall into. Even we as doctor them. Somebody come to you, you say, what's not the BP? They say the BP now 110/60. You say fine, but you forget this, sometimes the original BP we get now 180/100. So if you drop them, then they go cause some problems, and sometimes I make the person fall down and collapse. You got to be really careful with that. So, as I say, high blood pressure, obviously, then get things the way linked to them, things the way they cause them. You know, the person in lifestyle, then the way they smoke, and the way they drink, or not only drink beaucoup, but some people in the way they drink too much, and then they call them binge drinking. You can go, you save 1 month, you not drink. Then where you go now, you go drink, like say, you want for the rum killer rather than the salary killer. You know, so you can go take some 10, wait for don't take for 10 weeks, you take on 1 day. Then they can cause problems. So then people in there always they get to be careful. People in there way a bit overweight, you know, themselves can get, you know, that thing that can happen to them, so the blood pressure can go up, they don't even know about it. And of course, then we know the exercise. We all, as we know in the country, yeah, we know the exercise enough because we can do, you know, advanced country, all thing between your arm and your foot them. So you can easily just reach out, get your remote, you know, go out and all that, or go grab, go watch the television, you know. So you have to be really careful. And of course, if you not treat the blood pressure, you definitely, they look at, as I say, from head to toe complications. Things like heart attack, whoa, the report. Then they all blood pressure can lead to that. Things like kidney problem, kidney failure, you know, things like stroke. All that things that they not in the way obviously linked to the blood pressure. Again, the blood pressure on the low side, where I say 90/60 or less than that, something then they we can cause that, you know. If somebody they not drink, they not eat, like where some people they can dip and fast at the same time, then they take blood pressure medication. Clearly, the pressure can go down, and that it can cause the people to begin feel they turn, they begin feel lightheaded, they begin feel weak. And if you know stop for taking the medication, the heart will begin go into overdrive, and that can cause a lot more problems. Then it can cause the heart for failure as well. So you have to be careful. But before I go too deep into this topic, I just want the host, TM Bia, unmute everybody and make we just ask people for C. This question now for everybody, and would I get them? Well, probably a very clever person until you go get present. Yeah, the question is, whose animal then, or whose animal, yeah, or whose animal, they immune to all the sickness the world over? Come on, guess, let you guess. We don't know, make it tell me.
Google no mix so.
Google mix so. Google me.
That's for repeater.
Sorry?
What is the question?
Which animal will immune to all known diseases?
Immune to all the known diseases. 1, shark. 2, turtles. 3, skunk. 4, lie on them.
Turtle.
I will say talk to myself.
Turtle.
Yes.
Say shark.
Right. Any other answer?
Shark.
Hey?
Shark.
Oh, my sister, clever. Now guess or you know that? Now guess you guess or you know that?
Don't I guess?
All right. Shark.
Well done.
Can I for play lottery?
Indeed.
That's good, right? Let me give all of them. Right. So we go forward. So, waiting high blood pressure, as I said, no more. You know, the blood pressure can go up because of different reasons. And people are not even know about that. Now, the thing that we're not worrying about this. I make them call it the silent killer. You know, as they grow, you know, baby then get their own pressure. Now, make if you go, if you can't go baby in hospital, the cough when they look, when they use for measure the pressure in small pass, you already use for the big one. Because what you do, if you use the big one and the small picking, it will give you a false reading. And then you will begin treating where you're not supposed for. Likewise, if you go put a small cough and big person, even the big one, then the hand away, big, small bit, you go put a tight cough way, small pass, the one way the arm day, the size they were like that, it can cause a false reading and that can cause you for begin treating. So not danger than they. Now make it nice for put So picking them, then get them pressure. The adult, the young adult, then get them, and as they go older now, so this blood pressure they go. But the blood pressure, as I tell you now, is so important that the World Health Organization decide to declare one day in the year when a World Hypertension Day. Will not be no, but that the 17th of May every year, na World Hypertension Day. So make you know, you know, just for tell you no more. Say hypertension na world killer, na known killer, and I make you see the World Health Organization definitely decided them for declare this day so that people then will take more attention, pay more attention to their health and do something about it. So, if we don't talk about that, we need to talk about the two types that we know about. We get primary hypertension, we get secondary hypertension. And of course, we get risk factors that we tied to dating them. You know, the primary hypertension, Bokuman, they call them essential hypertension. That's what the doctor didn't call them. Then they now, take today, I don't think anybody don't identify, don't find out where to make this thing happen. So man can blame the genes, like me and papa and mama always something then get them. If myself they well, like myself get them, so clearly a possible say the genes that get a big role for play for this thing. You know, physical changes in the body. So Monday in kidney, way is small, okay. By 10 it turn adult, it's fine. But then somebody will get kidney problem. Clearly, ion can go up without you not even know, and sometimes that can cause a problem. And believe it or not, hypertension can present as a stroke, where the person not be ever know about that. Say you get it can to you now in the form of a stroke, or it can to you in the form of a heart attack. So it's very important for me to pay attention to them here, that the blood pressure they creep up on you. Now make you see the kidney get a big role for play on this because waiting in the kidney, now they excrete, now they take away most of the tablet they take. So therefore we need to look after. And if you find out that the regular blood pressure, when you go to doctor, he begin put you on medication, they actually check your kidney function. If not 2 weeks after you begin you the medication, you actually do maybe 6 weeks. And if you increase the dose, and so you go check out. Say you get and make sure say this one they work for you. And in the year, you get for go like where the motor car and they go for MOT. And that MOT they then get for check out the kidney and the work, the liver, and whether you get possibility of diabetes on board that blood pressure again. So that's not the primary one where nobody know what's the cause. Then the one, as I say, the physical activity, physical changes in the body, and of course the genes, the one within the for look into potentially. Apart from that, the secondary one, then our done the way they develop because somebody gets a particular sick. Now this sick, the way we know, one pandemic na kidney, as I've been say already, kidney disease. Now one thing we can cause the blood pressure will go up. No questions about that. People that we get too much weight, so then the way they sleep now them back. You go read and see, then they snore, then they draw sleep, you know, trunka one, sometimes they play music for yourself, you know, and then you go, yeah, all of a sudden you go, then you go, it's snore, then all of a sudden you go, and then you wake up, you know. Now, that kind of person, you got to be careful because that person, they tell you, say, you get this obstructive sleep apnea. That means it is tough for breathe. And, you know, and the brain now, they go into overdrive or let get them back for begin breathe. Then people, they're prone to blood pressure problems. People that we get picking their way, then bond them, then get a hole in the heart. If they no block them or they not close in time, they can develop blood pressure later on. Then people will get this thing na free tongue on a salon where we know that get in a throat, goiter. The thyroid the problem way overactive, it can cause blood pressure for go as well. Again, as I've been talking, the medication then we they take, sometimes then they can actually get side effects that we can cause the blood pressure for go. And of course, with that in there, people in the way they take the illegal drugs them, marijuana, cannabis, some man can even take tramadol, some man can take amphetamines and things and all that. And of course, I don't know if you remember this drug, that kumbejara. Salon, Africa, women they grow up, that kumbejara, the way they make you like say you just go off your head, and then they can cause dentin. I will not talk about alcohol as well. Then the way they drink them too much on a daily basis, and then the way they say they go save something for 10 weeks, 8 weeks, then they go then drink let's say 1 day for equal to 10 weeks. Then they say, then you get one gland where they on top the kidney them, where they supposed for control the metabolism of the body, and how the body they metabolize some certain enzymes them. That is if you get a problem, the suprarenal gland, clearly that is can cause blood pressure to go up. And then the out for control. And then of course you get some tumor them, some cancer them, some growth them, we can cause the blood pressure to go up, like insulinoma, where they produce that, that in this. So as I say, we don't talk about this. So the systolic blood pressure, now the one with the number with on top, ideally they say for be 120, but follow suit, like you say. And the lower one, the diastolic one, now the one with the bottom, then they say 80, but that not follow like that. You see, if your blood pressure, we then go check when you go to the GP, it will actually say, all right, if you can't check your blood pressure, because some man get this thing called white coat syndrome, that we go to see doctor and you have begin beat, begin worry, begin jumping up and down, then they push the blood pressure up. So if you go to the GP and then you go measure the pressure straight away, the possible say the pressure will be very high. So the way for do and allow the person for day, you rest, calm yourself down for another 10, 15 minutes before you actually do the test, measure the blood pressure. If, however, they measure them on 3 separate occasions, the pressure is still there up, then clearly they need for begin check you, for test you, for see whether there's a problem. And one of the main things that you see, now the urine important because if you get a kidney problem, it will show that the urine, definitely, yeah. And of course, you see, now the cholesterol as well. Now that we will let the animal give them. Some man they will eat and first you get like 6 creatures na the plate rest. When in actual fact you're supposed to get more of salad and things like that. So cholesterol naturally catch up with we. Then go for check that for see whether then they up or not. Of course, if then they no yield any fruit, then they no give you any answer, then certainly they find for let we do that heart tracing, we then call electrocardiogram, ECG or EKG. As I said just now, somebody will get heart defect, somebody will get a hole in the heart. We know about that, then they can pick them up, that ECG they can pick up. And then of course, if that did not do anything, then the ultrasound, when that machine, when they use like them, we get Bεttεh, then pick them, and ultrasound they can check the kidney them, and for check the heart. If the heart in heart failure, then they can give the reason for make the person nothing and make it get blood pressure. If the kidney again swell or the kidney shrink, then you can know from the ultrasound as well. So, as I say, now 4 stages now we get of the blood pressure. So as I talk about this now, 120 over 80 are the ideal one. But that not necessarily means if you get one win at 130 over 90, that means you don't get them. It just means they elevated a bit. Now the way they go up, a lot of things can make it go up. If you drink a cup of tea way hot, you drink a cup of coffee way up, and people already drink them, you call them, then energy drink them, then they can go up as well. If you eat or you run or sometimes snake appear before you finish, the blood pressure go up. But it could just go up for a certain period, then it could come down back, But if you get blood pressure with the 130 to 140, when at the top one and the bottom one 80 to 90, then they're not measuring at 3 term. They still differentiating as well between 140 over 90. Then they will say this is stage 1. Then if you get one way, this is between 140, 150 to 90, then clearly down in stage 2 that because they get information different one. And of course, if you don't go now up to 180, that is systolic, the top one, 180 and above, and then the bottom one go beyond 100, as you can see. 120, then clearly dandy a worrying sign. And dandy, anybody will get that need for the friend hospital road. You need for get an ambulance because dandy they lead to stroke. And if you get chest pain with that, clearly dandy can lead to a heart attack. Now make you fine for making them send you to the emergency room straight for go try for bring and condom so that you can avoid that thing to continue. As you can see, this just tell you exactly what I just told you. You see, the normal blood pressure, if you see you go see. Then tell you say when you get blood pressure below 130 and 85, you for keep up the good work, yeah, and continue with your heart healthy habits of eating, you know. And of course, by the time you go to 140 over 90, when you get for make some changes in your lifestyle, you know, for bringing the blood pressure down. By the time you get to 160, imagine also 130, 140, by the time you go to 160 over 100, you need for see a doctor. I repeat, you need for see a doctor, you know. And even if you do on medication, if you see the blood pressure they rise to that level, you need for see the doctor for make you see whether something that we go do for try for bring and condom, whether you go add one more medication, or whether they will look for see anything else to happen in the meantime when they treat you. By the time you get to 180, as you can see, to 180, clearly, then they on that you need to see them straight away. And you can see how the color then go. So, like the traffic light, green, amber, red, you need for avoid the red. If you get anything that the red, you need for go in the emergency room. You go meet me there, they wait for you. All right. So, symptoms, as I say, now in Bokuman, no. Now the thing this way, I think that the slide this way get the thing. Because Bokuman, when they can get hit that, they nobody no say these are symptoms of hypertension, blood pressure go up. So man can they begin get short of breath, they find that difficult to breathe. And sometimes I don't hear some people and tell me say their nose they bleed. Yeah, then they say even though no they on anything where they thin the blood like aspirin or warfarin or clopidogrel, but then they get nosebleed. Now, obviously, if you don't get that allergy, that hay fever, where they make you sneeze, then you begin bleed, that's different. But if you just say you don't get them, you just begin nosebleed, then clearly you need to check the blood pressure. Again, some people have face skin red, flushing, that is the other sign. So man, like yesterday, I didn't walk, this man had been known hypertensive, he lost 5 stone. If he say in blood pressure don't come back to normal. So he left for taking blood pressure medication for 2 months, and then he came to me with dizziness. I look at him and say, oh my God, what's in the happen now? When I measure the blood pressure at 180 over 100, be know that. He said when you measure on our O's, now 120 over 60. So it just goes to show you that the blood pressure can go up. Now, maybe not because you didn't hospital will be or not, but as long as you don't get the diagnosis registered, you don't get that label, that you're hypertensive, it can creep up on you where you don't know about that. So it's important to make you keep in mind. If you feel any of the symptoms there, you develop chest pain, you develop problems with your eyesight, you need to see clear, you get blurred vision. Or if you see blood in your water, where you go past water, in a toilet, you see blood, and clearly then they need for guide you for then you go get checked out and then you get for see your doctor. As I talk no more, if you not look after the blood pressure, well, the blood pressure will look after you. And the way you go look after you, they cause the complication there. I just named this now. If you look at the top right, now yeah, you will see stroke. Yeah, if the bleeding take place in the brain because the blood pressure shoot up, you go to 190, 200, it can cause stroke. You can see the heart, it can cause the heart for fail. The heart not able for controlling itself, for doing functions, so they fail, and then they can cause problem for beginning get shortness of breath. Now make I've been telling that this is shortness of breath now, another symptom. Again, then papa and mama business for we demand them, then they say it can affect people bad one. So if Monday if they experience denting, then they fit for lead, then get check them out to see whether they get blood pressure or not. And so take a long standing and know about that. Again, it can cause blindness. Yeah. At the same time, it can cause problems with the vision. So these eyesight they fail. Now make you find every African American at the age of 40, make you go check in your eye because we're prone to things like glaucoma. At the same time, you get what they call hypertensive retinopathy. The back of the eye, it is important for look at every year. For people who get blood pressure, they're looking at that they do all year. So important. Of course, if you get chest pain, well, remember, if you're not a hypertensive patient, it's possible that you're going to get a heart attack. Until proved otherwise, you need to be checked out. Again, we don't talk about the kidney. The kidney, of course, can fail. And besides that, now in the main organ where they take out all the blood, the tablet, then the metabolism when they don't for work, then they come out, the urine, and then they come out. So if the kidney get problem, then clearly the itself can affect it, and that can cause worsening of the functionality of the kidney. Again, we just talk about that. The brain, can you see? You know, you get this encephalopathy where it can cause the brain become unwell, confusion, headache. So man can begin get seizures, he can get that fit, you know, can get a stroke. If somebody get a convulsion where hypertensive, definitely you need a scan for make sure say you don't get a stroke. And again, the blood pressure can go up to the extent it take with them the sugar levels as well. So the person can say have a diabetic, and this need to be looked into. I talk about this, you know, the hypertensive retinopathy, looking at the back of the eye every year. And of course, the heart attack and the heart failure, of course, the muscle then at the heart, if they don't work, they of course cardiomyopathy, which can lead to heart failure. Kidneys, them, hypertensive nephropathy, you know, and the chronic kidney disease. So, of course, when you don't get this diagnosis, well, then get for treat you, you know. So, the primary hypertension, that's not the people in way get this hypertension because they get them from the genes, you know, then definitely the doctor could just say, well, maybe change your lifestyle. You know, if they eat too much, you know, fat and salt and things like that, then clearly perhaps you need to look at that. You need to probably try to do something about your weight, exercise more, eat less, you know, so that you can bring that, and then they can bring the pressure down. But the one doing at the secondary, one day where we know say get different sick, then the kidney, the liver, the adrenal gland, you know, the heart and all that, the thyroid and all that, clearly then we'll start you on some medication, we then go able for watch. Now that medication there, I don't know if we will go into them, but we're not going to hear about them. The ACE inhibitors, them, the angiotensin receptor blockers, the calcium channel blockers, the alpha-2 agonists. Now the ACE inhibitors, you get enalapril, ramipril, lisinopril, you know, and then the angiotensin 2, the calcium channel, and I know, but amlodipine, ifidipine, you know, and then of course the alpha-2 agonists, then they win the candesartan, olmesartan, and then so then of course they get beta blockers as well. The way they slow the heartbeat. So man, if you go sometimes you go for a checkup, you see that the heart, you know, slow down. Now because sometimes the medication is there, but sometimes some man can overdose on themselves, and then the heart so slow that they never forbeat like I forbeat, and therefore the person will feel dizzy. So that kind of person there, if you can't clear enough, try to reverse the effect of this beta blocker, where all man know say now bisoprolol, so man know about propranolol, you know, atenolol self would the area about ESF and one pandem. Then you get diuretics, then that way they make you go past water, plenty one. Then get indapamide, then get furosemide, get different one. Then they obviously now for pull the extra water and this extra sodium with the salt within the body for making help for bring the blood pressure down. So these are all things that they use for try to get you for you control the blood pressure. Of course, we get the home remedy that we all talk about. You know, if you develop a healthy lifestyle, yeah, you exercise more, you use more fruits, more vegetable, you eat more whole grain, you eat more fish, and you eat lean meat, then definitely you will lose the weight, and you will definitely not only prevent them, but maybe you go stall them. You will make it delay for the stroke, the heart attack, you know, the blindness, the kidney failure, and all that, and you will delay them because you don't develop a healthy diet. You know, a lot of people can talk and say when they lose weight in that healthy way, they can find out that the blood pressure controlled better and they feel better in themselves. So, as I say, again, a nice for we take steps for reduce, you know, the blood pressure and for prevent the complication the way the blood pressure in high one can bring about. So you need for you aim for eat more of the fruits them and vegetables, you know. So if you aim for eat, you know, 1 to 2 and increase that as the week then they go by, it go nice for you. You need for aim up to 10 servings of fruits and vegetables per day, you know. And remember, again, not to just the food where they eat, but again, that the portion there. If the portion big, like some man go, you don't go exercise, I can't put something 2 ball fufu with obiata, well, like that, you know, weight you born from weight you put in, definitely not equal, and therefore you will put on the weight. But if weight you born more than weight you put in, definitely you will lose the weight. Remember, for cut down on the meat, and if you eat the meat, maybe 1 go don't do, and then the rest now, if I fill up the plate, if I make you use salad, and then thing them there, you know, smaller when them there. But small portion, bigger salad, and not the opposite, a big portion and then less salad. So we don't talk about them, as I say. If you see this particular slide, very good, because they tell you now exactly how the blood pressure they see normal now, yeah, 120/80. It is slightly up between 120 and 140/90. And then by the time you get to 140 and above, over 90 and above, then clearly that's what they call hypertension. So that one with the in between the 120 and the 140, then call them pre-hypertension. You know, that is the dangerous one, because some man if you see they under the mental and say they borderline. Now when the thing creep up and go into hypertension, now you don't know about that until it present the department with a stroke or a heart attack, you know, or maybe you know they see fine, you know. But you see, 8 lifestyle them way changes with them and recommend, as you can see, get moving. You know, the government don't decide to then go put more money for cycling. I think they get for decide say people then get for land for cycle. So then they will not be cycle, well, maybe $10 for land. If you're able, you know, focus on the nutrition, you have to eat well, you know, cut down on the salt. Now that is very important, because salts, they draw the water into the body and increase the blood pressure. You know, take your medication religiously. Take your medication religiously, because it's important for maintaining that blood pressure. And of course, get your blood pressure checked every year or every 6 months when they call you in for go. Remember, lose weight. Different ways they for lose weight. Believe me, if you eat healthily, you will lose the weight, you know, and make you fine for do this intermittent fasting, we all they do. It's absolutely superb. You know, if you drink, cut down on that. If you smoke, well, remember for throw away the bad habits, because clearly they know they help you at all. And if you stressed out, well, try to avoid the negative stress there. If you're able, try and sleep well. Then they do well for the blood pressure. No questions about that. You get massages, you get yoga, tai chi, deep breathing. That they don't find out in that way they help, you know, and even the meditation. If they're able to do meditation, then clearly that they can help you, you know. Then I need for telling about this thing. As I say, we need to go deep into them. But if I'm for them, we know say we sister them, we mama them, we auntie them, we wife them, then get this possibility for develop this thing when they can get the way then they carry baby. You know, that's way really dangerous, because if you not take control of them, it can cause eclampsia, which can bring about complication to the baby as well as the mama. You know, I don't see people that lose their life from that, and the baby clearly end up with a lot of problems when they begin grow. So preeclampsia, if you see the woman, they put on too much weight within 1 week to 2 weeks, you put a lot of weight, and the blood pressure they go up, and when they dip in urine, they see say protein dip on them, they need to keep an eye on that. No questions about that. We will talk about that, you know, in details, but when I need for no say, yeah, one special circumstance of blood pressure in high one, now preeclampsia, and then they mainly more dangerous with the mommy will get the belly and the picky way they carry. I need for telling about Gentri 16 them won't I need for know. If you not be know about this, blood pressure in high one, hypertension, a silent killer. Of all the 5 leading illnesses in the world, 4 of them linked to the blood pressure. It's a silent killer, and it creep up on you when you least expect them. You know, remember, you not go know until pass you sometimes, then bring you come with a heart attack or a stroke. You want to avoid that. Believe you me, look at this bottom bit now. Can you imagine that? 5 million people them with the undiagnosed with blood pressure problem. 5 million. Yeah? If you look at number 3, you can see say 14 million people them. 14 million people them in the UK get high blood pressure. And amongst those 14 million, 5 million they we don't know say they get them, and of course they don't diagnose them, and they don't get any symptoms so far. But one fine day the thing just creep up and then I mind that, you know. And remember, it's all a matter of numbers. Now the numbers they need to look at. If the blood they find that difficult for push, the heart they find that difficult for put the blood through the veins and the arteries, the blood pressure will go up. So you aim for 130/90. At that night, the thing they aim for. You know, here they say 140/90, 140/90, that's what you talk about. Yeah, exercise. If you exercise, you will reduce your risk of the blood pressure and, of course, the risk of a heart attack or a stroke. And, of course, this will definitely inspire you for making go forward. If you drink, remember, cut down on that. I not say no drink, or meaning the drink, but I not go tell you say no drink. Understand? Then he say he is pleasure, he that drinks with measures. So if you drink, cut down on that. And if you smoke, clearly try for keep away from that. So I say make I don't talk this day, I don't scare you now. If I'm for level I see the thing the way and a nice thing for eat. So you get raisins, them, banana, dark chocolate. Now that don't mean so you get for go overboard. Now, but just in moderation. Alkaline water, spinach, garlic, orange, kiwis, and cherries, the mango, tomatoes, Brussels sprouts, all that things that we then picking on like for it, lentils, kale. Now making that for level the first then for it, garlic, watermelon, hibiscus, and then berry, then they, as you see the number. Then they have this again, I think they have, wild cabbage, pomegranate, pistachio, then they will like their nuts there. You see the vegetable and berries, beetroot, banana, salmon. You see, they don't put beef. The salmon they put, and they seed them, of course. Yeah. So I go stop now, yeah. But I take this picture for Leone look at them and see. If now one we talk on any word we see on this thing, I like this slide because this slide now he actually get the figure, the shape of the heart, and he actually tell you a lot about the blood pressure. So if you look at them, you want to talk about anything, by all means, please, just let me talk about them. But I look for one particular word where if the person get them, he will get prize. If you get them more, you will get prize. So when I look at them, and then we will talk about them. But I thank you very much. Thank you. Dan de sabi Spanish na gracias. Dan de sabi Russian na spasiba. Dan de sabi Arabic na shukran. Dan de sabi German na danke. Dan de sabi Italian grazie mille. Merci. And in Mank we say cha. Thank you so much.
Thank you very much, Dr. Kamar. Now, I'm a family them. Dr. Kamar don't present. Now, an opportunity now for ask questions. And when I can either ask by the way, when I raise my hand on the tool, or when I can raise my hand, literally, I will go through. If I see you and I will ask, it will be first come, first serve. So today we first one, Auntie Victoria. Yes, you can mute yourself, ma.
Okay. Little boy.
Yeah, mama.
I called you on Wednesday.
Thank you so much. I look forward to that.
No, I called you Wednesday just past. I left you a message.
All right. Sorry, I don't see that.
Okay, I be just come up from the doctor. We did talk about this hypertension. My problem is, I dey measure my pressure at home every week. Then it's been monitored every month. But when I go measure and it's so low. And I get back to the doctor, it is way, 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 way high. Okay, eventually the doctor called me on Thursday, say I get white coat hypertension.
Yeah.
So what causes that? Because the way I feel last weekend, seriously, I been feeling they have a stroke. But then when I go in the measure, I way, way high. But you know that concern for say go hospital or anything. Because you don't.
This man, let me sister. So dear, if you win the prize, not to fix so.
Not to wait.
Not to fix. I don't know nothing but this word what they talk about. And the word what they look for now is just called so white coat syndrome. If you look now, you can see and they. But that slide there, you will see white coat syndrome. You look at?
Yes, yes. Hypertension.
Yeah, you see I'm there.
I see and yes.
Look at there. 90s. Look at white coat.
Ah.
Yeah, now that's what they have been to look for. And it's so funny that the first person who ask question that now you first speaker. Now I think I don't answer this question already. Where people in they go to the GP, clearly, where they go to now bad news they go for. Because not to say you go for let them go tell you bad news, but that's not what they expect. You know what I mean? So when you go there, one way or the other, the body says itself now in the main. Just like how if you came up before snake. You know what I mean? If you see snake now now only they run. You know what I mean? And then they make the pressure go up. But that now just transient. Now they go up for a wee while and then it can't down back. You know what I mean? The problem is if they measure your own a low, and then when you go to the GP a high, something not right because we can do either the cuff way they use now or the machine way they use now sometimes they give you false reading. That's now one thing can happen. Or when you reach there, you definitely worry, and because of that, they go up. Now I make what they do nowadays, then they make you monitor your blood pressure. So then you live like a page where get 7 days monitoring.
Yes.
You understand? And the best time for do the blood pressure now when you just wake up. I want people to know that. Because the blood pressure they go down the net. When you sleep, you relax. Now when you rest, the blood pressure they go down the net. And and so when you go down, By the time you wake, the first thing you do if you measure around that the true reading, because by then you go don't rest. You know what I mean? So then you have for measure around 2 different times there. Now morning and evening time, so that they will get a pattern. They will get an understanding as to which thing they happen and how things go, so that they will decide whether to either reduce the medication we they on or increase them depending on whether I need a kind of. I don't know if that they answer the question.
A bit, yeah, a bit. But you know what, you don't say that if you don't reach 180.
Yeah.
It's very worrying. I was sent home. I make a call you that Wednesday day.
Okay.
It was 180 over 101.
Yeah. But when they measure them at the GP.
No, at the GP, me on a house, it was 136 over 86.
Yeah.
But at the GP, it was 180 over 101.
You not been worried about anything?
Well, I don't know. Whenever I go for me, I can calm. But as soon as I reach, there's a particular nurse. I can just.
I was saying that to Victoria.
Well, that's it.
That's it. Just take that stimulus. Just take that stimulus for
yeah.
That's it. Now make you see the need for measure up after you don't count up.
Yeah, after.
You know?
Yeah. Antiquity, what is say so? Avec research don't come out, we condemn the fact say most times when they do research within the hospital, it come of course because of the post-initial environment where it first say a confined space for them, not like a doctor use space. So most of the time they research they come out force. So I make they allow say they then go away from the environment and they then get a clear picture of what they actually look for. Like what you say so clear the case.
Yeah, maybe if you go to the GP, choose the day where the nurse not did it.
Well, I will do the next time. I define
that will definitely make a difference. I show you that will make a difference.
I'll go ask
Auntie
Aziza as well for both guests. You get anything for add to this?
Yes. Hello, all man. My name is Aziza. I go try to talk Krio.
Yeah.
I just want to add, Mina Dr. Aziza say, I just want to add for say, as well as the doctor go tell you say for do your blood pressure and na os na morning and na net, what he can tell you say na for do it for 7 days, okay? You do it for 7 consecutive days. So if you start Monday, now for doing na with yourself, you day na your own room, you 1 grain, sit down for 5 minutes. Do your blood pressure, wait 1 minute, record the 2 reading where you don't do 1 minute apart. Do that in the morning, na net, for 7 days. Your GP go look he go average and he go sabi what he go on with your blood pressure. If your blood pressure high, he go tell you, say, okay, we get for do this, we get for do that. And the all thing where Uncle Dr. Mohammed Kamara don't talk say. Other thing where they can do, because sometimes people there where they anxious, even if they didn't and they 1 grain. As soon as they put the machine at their body, they stress, okay? They can stress. So the reading again, sometimes not go be accurate. So your GP go give you machine where you go na os. You take it give you in the morning, and then you get the machine, you wear them all day, okay? And then you go do the average. Then what we can call 24-hour blood pressure monitoring or ambulatory blood pressure monitoring. And then the machine go see, you go do what you can do in a day, all thing what you can do. The machine go record all the reading them, and then you go average them out. And then again, based on what the machine tell them say the results, now then that result your GP go by, and then go give you the accurate reading. And based on that one day, they're going to say whether, yes, you get white coat syndrome or you get hypertension, and they go treat you that one day. Because obviously, if they give you medication and you don't need them, then your blood pressure go too low, and then they say dangerous. Okay? So I hope that answers your question.
And then to add to that, then get the third option where then they actually bring you in the hospital for do the monitoring as well.
No,
when
sir.
you say it's catastrophically high, then can actually bring you in the hospital for monitoring as well. But that's one then, you know. But mainly, I didn't do the day where you do them 1 week, and then obviously you do your own monitoring hours, and then if that not work, then they get for bringing up to see whether the kidney they fail or not.
Little bro, you know me and hospitals. So
I know exactly.
You know me or not?
I said no, sir.
Okay. Thank you very much, Auntie Victoria and Dr. Kama and Dr. Siste. The next person, I get two people. Ahmed Fala, na AC and Force, and after that, we get Kari Fala. Then we'll go to Auntie Abibatu. So I will go to Mr. Ahmed Fala first, please. I don't unmute you, sir. Yeah, try for unmute yourself as well. Yeah, there you go.
Good afternoon, brothers and sisters, and it's a pleasure for me for joining this team today.
Thank you, sir.
For the past 20 years, I've get high blood pressure, and it won't be very, very high because I live in Germany, and the highest was 220 to 110. So I go to several therapies. Then the best result probably don't ever get now 160. Then the lower was 100. But when I came to England for the past 6 years, so I be do now, North Manchester Clinic. Then because definitely I be develop hepatitis. I said diabetes type 2. But last year successfully, the father said me and Tons syndrome, the adrenal gland. They take one of the adrenal glands. And from that, now, presently, no need nutrition medication. Are you get me?
Yeah, it kind of break a bit.
Blood pressure. Even in Germany, they not be ever discovered, say, my adrenal gland, they produce a lot of unwanted hormones. Syndrome. So I would say if the doctors they try as hard as possible, because they only do say my adrenal gland be a bit swollen when they go to the magnetic scanning. And when they do them, then take the then successfully I do an Salford Wεll in December. From now, the highest reading was 138 and 90, but it's normal. So they advise me something like that. They advise me for take the lowest form of amlodipine. But before, I was taking the highest, most. I take different type of blood pressure medicine and even me heart because the heart be pumped too much, enlargement of the heart. But now presently, I feel good. I feel better. Very, very, very positive. Yeah.
That's very good.
Hey, thank you so much for that. Nice for let me get people in that way to give you the testimony of how things they work out for them. Now, I know one point finger upon Germany. I know go say a bit and walk, but perhaps if you've been getting time to tell the size where you've been there, that adrenal gland problem there. I think I talk about them. If you listen to the talk, you can see I talk about that and some tumors them as well as the adrenal gland. I think one of the causes they have been listed, the adrenal gland dependent, So then they can really stubborn for treat, especially with the kidney and the suprarenal gland, clearly difficult for treat. Then can lead to the hypertensive crisis, and then can lead to all the other things that we talk to the heart failure and the cardiomyopathy and all that. But once they notice them and don't treat them, as you say, clearly it can bring the pressure down. And you, as I say, in a testament to that. So thank you for sharing with that. And you really brave for Yeri, somebody come forward and actually talk about yourself personally, but that is what this is about. Thank you so much for that.
Yeah, thank you too. Yeah. Thank you. I'm very happy to get you guys, and I even post all the people and for letting join this team because it's very important.
Yeah.
Thank you so much.
Thank you.
Thank you very much.
Thank you.
Thank you very much, sir. The next person we will go to now, Mr. Karifala. Mr. Karifala. I don't unmute you. Try unmute yourself as well, please. Okay. While you try to do that, I will go to Auntie Abibatu. Try for unmute yourself, please.
I don't.
Okay. Okay, Auntie Abi, you wait. Yes, Mr. Karifala. Go ahead, sir.
Okay. My name is Kramodabo. I call from London.
Okay.
Now, thanks very much, Dr. Kamal, for this great insight into them problem that way. I believe to say most of we get, but we not even know and we know it's serious. The only side I want for understand is, is there any way where the opticians, where people that can get eye problems, good opticians, be able to make say you get problem like that there, because you talk about the retina or this when hypertensive retropathy or whatever, I don't quite understand.
Yeah, retinopathy, yeah.
Yeah, when you go to your opticians for eye test, is there any way where they can able get any hint of that for let them be able to recommend you for legacy GP? Because like they say 9 million people there or 5 million people they don't know nothing about this. Say they get hypertension, they go about that. And this time is silent killer, like I say, you know. And most of you sometimes they can go to with opticians. They're not able to know at all for let them give you hints for let you go for something.
Well, I mean, the optician, we just said, when they go medical school, I think Dr. Aziza could actually bear me witness. One of the things that we can come to exam recognition of problems with the eye, you know, the retinopathy, you know, like when the person they get that kind of problem, so they get a detached retina where they see like veil there in front of them. All the things that are part of the symptomatology, the symptoms, the way the blood pressure goes. So the optician clearly foresee that back of the eye, they foresee how we did. If the optic disc actually clouded and actually blurred, it's supposed to say that. If the pressure at the eye high, it's supposed to say that. So clearly, in need for able to recognize that and send you to the appropriate ophthalmologist, then at the doctor, we will actually look into that and see and measure the pressure and look at the back of the eye. You know, so Monday, as I say, most of the Afro-Caribbean people them prone to glaucoma. So everybody, I recommend that to at the age of 40 and above, please make them a habit for they go see optician because you can save.
So glaucoma get any link with hypertension then?
Well, the pressure in the eye, they go up.
I see.
That's the thing with it, and that 90 causes blindness, 90 causes headache, 90 causes pain in the eye, and the hardening of the eyeball itself, and of course the blurring of the vision with the eye very red. You know. That's how it is, because if pressure go up, then they block the secretion of the tears, the water where they cry, that water where they come out. They get that, they call them Schlemm canal. That canal of Schlemm, the water they pass, they come out. So then they can block because the pressure that the eye go up. And if you go up, you block them, then clearly the pressure will begin go up, and that will cause problems with the eyesight. So therefore, they need for give something for bring the pressure down. If they need for bring them with the tablets down, something that you need for do surgery about it, which you need for avoid that kind of thing because native are avoidable.
Okay, thank you very much.
Thank you very much, sir.
For recognize the signs of retinopathy, especially either diabetic retinopathy or hypertensive retinopathy.
Okay, that's great. Thank you so much, Dr. Kamal.
Thank you, sir. Dr. Aziza, you want to say anything? You want to add anything?
I just been want to say, talk about, because you're then in London and you say, okay, the optician, sometimes they can tell we say about VI then if we pressure high. I just been want to talk about NHS health check where they, again, so if what can happen in England and the UK, they get this thing called NHS health check where your GP go invite you when you age, when you don't turn 40, 50, 60, 70, they go invite you for do all them check there. So until you don't get any symptom, Uncle Dr. Kamara already talks in a silent killer. So now that make now the UK, they can invite people then for come, whether you get symptom, whether you don't get symptom, and then they go check all thing. And now they, beaucoup people then, they don't find, say, they get high blood pressure. So it's important for attend then thing then say, so if you think, say, oh, I don't get nothing, I not go. I know, not a problem. Then they want me, this GP ultimate, then they send me letter. Now for Yeri them, now for go, now for attend. Because now that way they go no say whether you get high blood pressure.
Okay, thank you very much.
Thank you very much, man.
So now, better than cure, definitely.
Yeah, now advice then they say we're going to go for MOT. We talk 40, 50, 60, we're going to go for MOT check. Okay, thank you very much, ma. And thank you very much, Mr. Karifala. Auntie Abby Batu?
Yes, hello.
Yes, ma.
Yeah, me Abby Batu. I listed the program and the follow-up.
Yes, ma'am.
I tell you, I think it's a very, very educative.
Thank you.
Mention. Me now one person way never know if say me get pressure.
Okay.
Not until so they can say medical examination. So now they go tell me say hypertensive. So they treat medicine they probably they drink. continue for the medicine and say I go the urge. But when I go there, I experience I really feel unwell after the rituals there. Like the guidance and me feel they really feel sick, they feel weak. So but I go to the salon I go several times and at the same medicine they no more than they give me. If na me room, you know me ever get I don't know. Not left for take them about where them people are they give me. So I stop for take the pressure medicine the way they give me. I want to stop for 1 week, 2 weeks. I feel since I begin feel better, I begin feel okay. So now that day, say all the we cancel alone. I can't explain to me, doctor. So now I say medicine the way they give you now they're not fit to you know agree with you. So it changed now. So I'm amlodipine what they take. So from that now they take them, don't get any problem.
Okay.
So I'm glad because knowledge on waiting doctor don't say.
Okay.
So I tell you now, thank you. Yeah,
thank you very much, man. Thank you. Me sample them just for say just for clarify with me and they say basically they may diagnose them, they may put them on some certain medication, but their medication they not be agree with them. We only find that out when he puts alone. Like doctor check them and realize the medication we take not right for them, they change the medication they have something else. Dr. Aziza and Dr. Kamara, wanna get anything for say to people regarding the type of medication them and how they can deal with anything?
Well, I mean, I will let Aziza deal with that because I'm in a GP and they deal with anything in the mainly. We know they begin passing for medication, but then when they start them on medication, we actually they look after them when the blood pressure go up sky high to the extent it actually will cause a stroke. Then we can intervene and do something. We'll give them medication to bring them kind down nicely and smoothly. If you get too low, obviously, as I say, one thing we'll be here for talk about now, either low pressure or high pressure, which one pound the two better. Now, for me, it's definitely better for me, I get the low pressure because then I can just put some fluids for now. If not blood, I put blood, the pressure will come off, or I tilt the bed, But with the high blood pressure, I tell you what, it's difficult to determine whether anything will do. And fine for you bring a car down sharply, acutely. It can cause a lot of problems for the brain can swell and a lot of things. So important for if anybody choose a low blood pressure rather than a high blood pressure. And make you fine for maintenance. But we in the A&E department, we need the comments, we need to begin people empower. We need to start them on medication. We actually they control the blood pressure rate go up. Now more the GP than they control that in the room.
Okay. Thank you. I'm glad for hearing this question because say when you take medication, because you put something at your body, all kind of medication, they do different things for different people then. So people then can see, I don't take this medication, suit me, I know they take them again, and then you stop them. And then continue for take them. So time go past where blood pressure go high, and then all there is there where Uncle Dr. Kamara don't talk about stroke, heart attack go happen. So what we can do, we can give the medication to the patient and we tell them, say, try for the next month. We go review you and see how you, what in the happen. We go tell them, say, what you can get. So for instance, if they start you on ACE inhibitors, so then like ramipril, or lisinopril, we go tell you, say, what it can happen. Sometimes you go get cough with this medication, or other people may get nausea, and then they not go feel fine. But usually, not just the beginning stages for the medication when you take them, because your body they get used to them. Eventually, all things go fine. But if you see, say, oh, you're not go manage with them, call your GP, tell and say, look, I get this, I get beaucoup problem with this medication, it don't suit me. What thing I get for do? Beaucoup different medication there where your GP go say, okay, let we try this other one. Because if we left you where you not take any medication, the risk is too high. So what you go advise, no stop your medication, call your GP, tell your GP, look, this is not the problem. This medication don't suit me, and then your GP go advise you for other medication where go help. Amlodipine when a calcium channel blocker, it can cause swelling now, people in foot as well. Okay, and some people say, they fit them. So it go try you with different medication. So then not what we can do. I hope that they answer your question. It sounds like say that Nadane your GP do self as well. Sorry about me, Krio.
No, absolutely brilliantly well. The other thing they can do, I think research don't find out from the Afro-Caribbean people them. One like this amlodipine, the calcium channel blocker, on your own, no, they work so no more. Like you need for combine them with another one. Most of the people they use that ACE inhibitor, either lisinopril or captopril or something like that. And that they make it work. So if one no work, they will keep, them keep for monitor you, keep an eye on you, to see and make sure it not go overboard. Because if you go too high, it can cause problems. So then get for begin monitor you for see how it's in the work. If one no works, sometimes then go for add another one. Sometimes in dynamic you can see some man get 2 tablets them. We combine or 1 tablet with another. Sometimes you need for put water tablet like the indapamide or maybe furosemide and things, So if you take amlodipine and then the foot then they swell, then they can give you something in a mild one for help you with that swell foot because then they can make people then begin get difficult for worker. So one way or the other, they get for balance amount. Now that's not the way they can do it, but they need for just monitor you and I go advise you not for stop or take the medication without the consent of the doctor. Without the doctor, don't know what they do for they try to get you for something else where they do better for you. All right. Thank you so much.
Thank you very much. Yeah, I get Antijaria too. I don't unmute you, ma. Try to unmute yourself as well, please. We hear you.
Right.
Yeah, there we go.
Hello, Dr. K. Hi, everyone.
Oh, look at that.
I honor the invitation. This is
Thank you so
Jerry from Delaware. Actually, myself na practitioner where they work na the emergency department, also intensive care units. One thing I don't see from we African brothers specifically is that these people are so afraid of taking blood pressure medications that they will come in hypertensive crisis most of the time because of what it does, the other risk factors that he has, their feeling of importance. And I think that is something that we need to address with our African brothers. This is what brings them in all the time. Then go provide the medications for them, but just for letting them feel like, man, it's a big issue. And I think we need to address that in our community.
Thank you so much for that. Thank you for sharing with us. As I say, so Monday, now that Friday, some man would prefer you take that country medicine, take that bangba, that cascra, or, then continue. And clearly, not to that, you know what I mean? We need to establish waiting at the cause of the blood pressure. And if it means you get for take tablet, well, I'm sorry. Me when they talk to Nanaya, because he didn't have the mommy and the side, at some point in my life I've been get for take up, and that's it. Not to tell you I want to do but I need to do that because otherwise I might end up with a stroke or something or whatever or heart attack. And so you look at the benefits versus the risks, then clearly you need to make up your mind. Not to tell anybody wish on anyone, but I need for urge her, for telling her, see clearly this thing is a silent killer. I never overemphasize, I need to put Fred on her heart. This thing that they keep up. Somebody, I think, just asked the question whether the blood pressure of a 30-year-old
is
high compared to the person in a 50-year-old are the same. But clearly not. If you get a 30-year-old with blood pressure at 150, clearly you need to forget that. It's important. But this, believe it, take it from me, believe you me, this is a silent killer and it kills a lot of people. And the people that we don't know so they get them, now then boku now make you see it worrisome. So please get checked. And as is at the talk 40-year-olds, 50-year-olds, 60-year-olds, if they invite you for your annual MOT, make sure you attend, please. It is important. It could be a lifesaver for you.
Thank you very much, sir. Auntie Sigugi. Sigugi, yes, ma'am. Unmute yourself, ma'am.
Thank you, Dr. Kamara, for your input. I've been just one for ask no more. I'll get 1 or 2 questions, but one for ask now the side effects of the medication them. Whether the ACE inhibitors, the beta blockers them, and the other waiting safe them, whether they get different side effects or they all get almost the same side effects where person they take the medication.
The different type of medication is also, the diuretics, then they get 3 types of them. Then get the side effect clearly, then they wash away some of the sodium and something, and and then the way they protect the potassium that we need for the body they work proper. You know, of course, you get side effects now. Definitely, when you look, as I talk on this, the benefits and the risks, now you look at. If at all the risk then too much for you, that, like for example, I give you an example, this is not to the same topic, but people away, they take statins, you know, simvastatin or atorvastatin for the high cholesterol. You find out, say, some man, they tell you, say, I'd rather die than take simvastatin because waiting do the pain where they feel. Now my body is so much that I'd rather die. Now, such a person, you definitely not go one time for not taking medication. Therefore, now they compromise. You as a doctor, I get for actually reach out to them and try for gear and something else will go suiting body. Just like how, as it is, you know, need for monitor you. So when you start you on that, you go watch for the side effects. If the side effects them not tolerable, yeah, then clearly they will look for alternatives. Then they different alternatives, different combinations. Then we go walk. But for say you not take them at all because of the side effects, well, I tell you what, I don't think you do yourself any favor them. I can tell you that for free. The side effects then believe you me, water self they drink get side effect. If you drink too much water at one go, it can end up killing you. I don't see somebody die because he drink 5 liters water inside 5 minutes.
Yeah.
So water self they drink when a natural thing, it's a side effect, and clearly it can cause you a lot of problems. No questions about that. But you need to consider your health. You need to consider the benefit versus the risk. Then, if na side effect we can put up with, then I go say go with that, rather than not deal with the blood pressure because you don't know when it will attack you.
Thank you very much, sir.
Okay.
Thank you very much. I hope say the water you not mentioned because it's here at the beginning quarter. Thank you very much, sir. Before we get another 15 minutes, so I look forward to more questions. Anybody get anything else for add?
Say something.
The panel? Yes, sir. Mr. Sise.
Yes. I just want obviously say myself I come on a family of risk factor. Understand?
Okay.
I lost my late daddy through this same condition. So myself, I get the opportunity to say, okay, I get the chances to get them test and everything, and make sure say I hold on to hand. But before that, honestly, at one point, I get a dizziness. I had no awareness of what would happen. And when I get checked, I get rushed straight away to the ambulatory department and they hold me there until they bring that car down to a minimum control before the next week home. So like I spent almost the whole day in the hospital. So ever since, as I say, the side effects to me, yes, they're there, but the benefits for now outweigh all that. So it's very important when you come up in that kind of thing, make sure say we continue to take the medication. I think I was so eager to know more where Dr. Kamara called the initiative say they want to present this program out today. So I'm so happy because for deliver in this fashion, and I'm so happy say you know everybody will give a contribution. So other people in back we don't show off obviously their own insight to what is already about. So I'm very happy. Thank you very much, and thank you to the team as well. As I say, look hand up, so I give chance. Let's say something.
Now, I just want to ask, man and woman, which one, or is it would that get more high blood pressure, man and woman? Because then they are very, very important for like we know. Yeah. Not supposed to let the woman feel complacent or let the man feel complacent, but at least get that if we get that statistics there, so at least we know.
Yeah, most of the young women then can get low blood pressure normally. Yeah. Pass on 10, then take in, then conceive, then get belly, then they carry on. I make it fine for let you monitor that blood pressure. As the human take in, you find out say by the time you get to 20, 25 weeks, then we'll begin monitor the blood pressure. See how you put on the weight. If the weight's too much, in 1 week until you put on 5 pounds or something or 5 kilos, clearly then go watch the blood pressure, watch the urine, make sure say protein not dependent. And if they say they go up clearly, then go for admit them and monitor them because as I say, it affects the baby, preeclampsia. And of course, I forget for telling you, I say, normally when the baby born, the blood pressure can go back to normal as it were, and that's what they expect. But if that baby, the blood pressure goes so high to the extent it begin cause the seizure, then there's no option but for do emergency cesarean section. So tell them this, you don't do them now, we will go for do them straight away because otherwise that woman will follow some, no questions about that. We go for born the baby, the emergency section, and then of course from there on, begin monitoring him, and you get for keep him at the ITU for 6 days, 7 days. But normally by the time they get to menopause, as you know no more, that particular dreaded M word day, as they reach to that, then the pressure can begin go up. So now they go up exactly the same way like the manual they go up. So now that you get for keep in mind, that make by the time they get to between 45 and 55, you then get to think about, you know, keeping an eye on the blood pressure. So Monday before that, so Monday now after that, you know. But mostly the young woman then, they can get low blood pressure. So if they come to you with low blood pressure, that's not normal. I hope so.
Thank you very much, Doc. Auntie Aziza, you want to add something to that?
Yeah, yes, absolutely correct. Recently, I've been looking at the World Health Organization. They talk say the African community, they get the highest proportion of hypertension, and they talk say between man and woman, then the same. The level is basically the same for men and women in the African community. So it's really, really high risk for us, and this is why we really need to take care and be careful, because blood pressure, hypertension is highest with us, and it's something that needs to be dealt with seriously.
Thank you. Auntie Victoria.
Yeah. You hear me?
Yeah.
Yes, ma'am.
Okay, little boy, you said something just about water tablets and potassium level. But me find out that they take water tablets, I think bendoflurazone, then stop me because it depletes me potassium level.
Yeah.
So I may be confused just now when you say I think the water tablets they help them.
Yeah. The water tablet then, I mean, they different ones. As I said, now 3 types. Then if you want, we can talk about that. But I don't think we'll get time for talk about them.
No. I've been just asked because I think you said something about the water tablet.
Yeah, that's it. You see, when they give the one way, they protect the potassium. Then they can just take away all, and mostly that the sodium, now they go, they can take the potassium as well. If the potassium gets low, like yesterday, the man would bring to me your potassium at 2.5. Clearly, I know people for send and go. Maybe do I want send them, but a 96-year-old man, there's no way you go come up 2.5 when the normal not between, 4 to 6 or 4 to 4.5 or 5 to 5. Clearly, it makes it a bit difficult for me for actually send because it comes in with muscle weakness. And that's what the potassium does. So normally we can just say, okay, go home, take one banana. Banana is a very rich, if you like, source of potassium. Really good, especially when we're not too red. You take one a day, that's really good, they go help you. But if you take something where they take the potassium away in the week, then perhaps they need to give something where go protect the potassium. Now I make them go give you potassium diuretic, potassium sparing diuretic, then call up. We go help you with that, really. But that, as I say, the GP then they in control. As I say, I see Dr. Aziza did not in head,
it just stop them. It say eat one banana a day.
That's it. That's what I'm saying. A banana is a very rich source of potassium. So clearly, if you suffer with that, and I make you see, if you watch, all that they play tennis, a banana then they eat most of the time. Because it's not only calorific, but it gets the nutrients they're putting them on for let them carry on with their strenuous exercise and, their healthy lifestyle. You see, that's it.
Okay.
Thank you very much. Dr. Aziza, you want to add anything? Yes, Auntie Jaya too.
Yeah, hi. The other thing, honestly, where I find very difficult in the community is the fact that most of our people not they try to participate in anything where concerning Black people, for especially in this hypertension modem. We can get a lot of sessions where we invite Africans for let them participate for things that will, at least if they do any research, what will benefit them, they do not participate. Do not participate, no, because then don't hold on to this factor, okay, whatever with man they do is bad for them, but if they're not participate, there is no way, because seriously, we don't evolve from the African Americans to Africans. We are Africans, and indigenously we are Africans, and there are other genetic factors waiting for taking into consideration for develop a lot of things, but Africans don't participate. If we get people for get involved in research participation, it doesn't even matter if you get for take medication, but just let them know your ethnicity. That is going to help us a great deal. And I think so we'll get for dispatch that information there to brother and sister them, let them get this notion, say, we are the ones who are suffering from this disease more than anybody else. But if we participate, it will be better for us in the long run. And that not me just me input.
Thank you very much, man. Not true.
Solid point you make. Absolutely vital point. You see, the apathy amongst the people and we, ironically now we this if they affect more and now they affect more. Yet now they pay attention to this thing, and that is the
exactly.
thing. I think this topic we have to revisit them again, again and again. And we need for sensitize people, and we need for creator awareness to people, make them know say now then we think about it. Because otherwise we all do what we get for do. But I tell you what, it's important for making somebody tells you this thing they kill. I tell you what, be good enough for listening to them and try and do something about it. Because they want you, and we not get spare life in the box. If we been getting able like the world, nine that so. But when you watch with people, then compliance, the participation with them get Wεll clinic, Wεll man clinic, in particular the Wεll man them. You man them, they can do well so far. Wεll woman clinic can thrive. But we, the Wεll man them, now we blokes, we the blokes say macho. In the day which you say, forget about that. And I tell you what, that apathy, now can spell disaster. No questions about that. So we need for sell the message to people. Make them know. Is it the stroke you want or control the blood pressure? Is it the heart attack you want or control the blood pressure? Is it the kidney failure you want or control? And I'm sure if you go to talk to somebody where they're on dialysis for kidney failure, they go tell you, say, you get luck. You understand? If you go talk to somebody where get for day, I know one my colleague, all say they run. This guy, if you see how fit as anything else, they get that thing they call widow maker. If they do exercise, they begin feel this chest pain. Believe you mean that God help them, and because he actually very meticulous, very, very, intelligent guy that he go. Now at the age of 41, you don't get a stent. But when you look at it in cholesterol, that is 7.5. You see what I mean? So these are the things. Now then see how need for talk, you understand? Go talk to somebody who don't get a stroke. Let's see, maybe they talk to you, they laugh. Now he can't even understand you. We need for begin listening to ourselves. It is important. I cannot stress it enough.
Thank you very much, sir.
Can I add one quick thing?
Yes, ma'am. Yes,
I just wanted to say that absolutely this is something that's really important, and also to say that actually getting a stroke or heart attack and dying would probably be better than living with the debilitation of the complications.
Super.
So if we can prevent it from happening at all, then we would be winning. But if we do end up having it, but we can control it by listening to the advice, lifestyle measures are such a big deal. You can make such a massive difference just by exercising, eating healthily, and eating healthily, exercising, not smoking, minimizing your alcohol intake. These are all things that you can do even without medication to make a difference in your life.
Thank you very much. You better way touch on that alcohol. Because I get some of the people in the personal people into me. Them alcohol, I will stop and no more. So we don't get 5 minutes left. I'll go to Auntie Rugi, then Auntie Jaria too. I see you hand it up, then we'll go wrap up for the day.
No, actually the previous speaker just touched on the point where I want to elaborate on about exercise, alcohol abuse, and things like that, because we see a lot of people, just like Dr. Kamara say, where they come with kidney dysfunction. And when you tell them what's not the risk factor, they say, oh, no, I just take one alcohol, I just take one drink, and you do that every week. You know what I'm saying? Every day when you take one, you put yourself at the potential of throwing yourself in the well. That one drink every week, they go, it just they push you further into the into kidney dialysis. And we get for tell people in that. And we've seen, personally, I don't see friends when are younger people than I am. Believe me, it heartbreaking. Seriously, even with this COVID where there are a lot of people who for safe, but because of comorbidities, you cannot be the only person standing there to talk for these people. I'm like, okay, first of all, they don't tell you said they were non-compliant. Non-compliant, what should you do for them? They're not going to left person where they for raise one as somebody on at 30, 40, with you on at 60, you're not being non-compliant because you say, okay, they listen, then go save you. They're not doing that. They're not they do that. So people and get for understand, say, you get for take the fact, now you own person. Like Dr. Kamara said, you only have one life. And if that they go, now go, you go. So, and we are losing so many people. Believe me. I can tell you the statistics. Now that work that they pass, so now it's a lot. Africans, we have to listen. And they're not afraid again because this systemic untrust what they get. Yes, yeah. Prior to now, we're not been getting exposure. But now with all of us, I think we people need for listen and we for engage them more. Thank you.
Definitely. So great mind think alike, Auntie Aziza, Auntie Jaria too. Well done. Yes, right. And you go be the last one. Then we'll go round for today.
For me, all what they talk so, if for fine for like all them talk how they talk so, I hope it they reach na salon as well.
Right.
You understand? Because a lot of people and they lost in life na salon as well. With all them things I see what they happen to we will they talk so now. You understand? Say like sexual dysfunction, where you up in a salon to the man they know for say something because he gets hypertension. Now you know they remember for say something because you get high blood pressure or anything. So you not get nothing for measure waiting they happen to them. So I hope say all way to the talk so we at least we this part of the world we get a health promotion. But Africa salon something it did it but it not better. We need better. I hope say it go reach people in a salon because some people in they drop dead. They say, oh, now do them. Now that way go cost then I know make it don't die so today.
Oh my God.
And it wasn't. It's because something has happened, you know. So I hope say we go able to drive this, especially when it comes to health. Drive and go to salon, let people they understand. We they talk Krio, so then they go make them understand them easy. We break them down even to this smallest of Krio, not broken to them, so that they go understand how to look after themselves.
Thank you very much, ma. If I'm with them, I may could try for do this show in Krio. I know some of you will not polish again like some of you back up. They try. It's our. So, Dr. Kamara, so I'll come to you for like round up for people, and then we'll go say bye bye for this week.
Why not Dr. Kamara get for round up?
Yeah. Okay, Auntie Jaria too. Now you go round up for me today. I will come to you.
Yeah.
I owe you.
It's a joke.
Yeah, Dr. Kamara.
This talk, not to talk, we'll go down now one day. We'll therefore revisit this one. And I say, I make a divide the talk to two. We don't get a chance to talk about the second part. But I will just one left now with this photo, this poster, make una see, this bottom bit as una can see. You see the normal blood vessel. Look at how the blood they flow normal. You see how this one they struggle because of the plaque way they that fat way lay and the voice of how they struggle. Now that they make the blood pressure to go up. You see. So if we want for control that, we want for stall that, we want for reduce that, we want for maintain that. If we get them clearly, then they could take a long time before it causes any problem at all. But in nice for let we know say the take-home message for me: hypertension, high blood pressure, na silent killer. So do ya try for kill them before you end up killing you. Thank you so much.
Thank you very much, sir. So me family them, if you need maybe because like this poster a valuable one, if you need to see all the pictures and properly, I can say let you reach out to we in the email. We will send on them poster so we able look at them properly and when I feel free for ask any question. Auntie Jaria, to you get anything you want to say as a last word to people that be promised they can to you.
Actually, a very good discussion. Just like the last speaker said, we really get for educate with people in Africa. Because of course, most of we don't get somebody who don't have hypertension. My dad did. They not be even understand. And the fact say we get for psychologically change their mind from this, then do me, then bagbamio, then this, that. Come on, that has to stop. It definitely needs to stop. But anyway, we're not for blame them too. We government need to do more. That's all.
Absolutely.
Thank you very much, man.
Thank you. All right. Thanks. Bye.
Dr. Sise.
Thank you, Mommy. Thank you so much.
Dr. Sise, you get the last one for people.
Before it kills us. Before it kills us.
Thank you very much. Well, we found them Manchester, London, well, the whole of the UK, Europe, Middle East, and the people in our salon and everywhere else in the world. We tell you thank you for when I join me today. Unfortunately, we don't run out of time. Anything that is life we get for come to an end. We'll tell you thank you. We will see you now in a fortnight. Next week we'll not get show, but the week after we will get. I will make sure we will bring out the flyer very early so we'll be able to remind you now. But I thank you very much. We really do appreciate you. On all good night and have